And joining me in studio now is Mr. Dean Janes. He's the CEO of Imaging 3 Incorporated. IMGG is a stock symbol. Dean, always good to see you.
Good to see you too, Don.
Now, Dean, I know that your company builds a medical imaging device, and what's really unique about it is that it can be wheeled into an existing room. You don't have to knock out a wall. It plugs into a regular outlet as opposed to hiring 15 electrical contractors come in and drop in all this stuff. Real quickly, why don't you just kind of give us the details?
Yeah, great. It's a revolutionary patented breakthrough technology. It's the Dominion VI scanner. It's a mobile device, like you said. Plugs into regular wall power. It scans around. It's a circular gantry. It scans around the body in 360 degrees every 0.2 of a second to 0.8 of a second. Takes those images, puts it into a 3D construct, and then updates it again every 0.2 to 0.8 of a second, thus giving you volumetric imaging or real-time 3D fluoroscopy or 3D imaging.
If you want to see some remarkable imaging, go to their website, imaging3.com. Now, you recently were on a trip. Trade show demonstrating to essentially hospital buyers, healthcare people. How'd you make out?
Oh, it was exciting. It was our best show ever. It's RSNA, Radiological Society of North America, the largest trade show of its kind in the nation. Over 70,000 physicians from all over the world attended. We had thousands of visitors. We had a great booth space. We were next to Toshiba. We were visited by just every major manufacturer out there. Were the talk of the show. Stryker even sent out their entire navigation team just to visit me. I mean, it was an impressive time for us. You know, having conversations with major OEMs, having conversations with potential companies or customers. It was a great showing, and we're looking forward to having some follow-up meetings with some of these OEMs, and you know, all of them are anxious for our FDA approval, which is pending. But it was a fantastic show. I felt really great being the pretty girl at the prom.
Now, of course, we're not talking about a piece of equipment that you buy on TV for $49.95. It's like a $550,000 piece of equipment. It must have been really something to see these medical facility buyers and physicians look at this thing and see the size of it and the portability of it. And I'm sure you had the plugs thing out in the middle of the floor. They could see it was a regular outlet, correct?
Oh yeah. I mean, it was. They were all impressed. I mean, again, we were not just the talk of the show with physicians, but with you know, most of these large medical manufacturers. You know, it was very impressive with our new imagery, with the new software that we were presenting at this show. I mean, we had a very, very strong showing, and we were very pleased with the leads that we came off of that and the conversations that will continue from that.
Now, I think it's important to point out that you mentioned pending FDA approval, and a lot of people will watch a program and say, oh yeah, when's that going to happen? But this is something that you're not unfamiliar with. Absolutely.
This is my 5th 510K application. As I try to remind my investors, it's not really a question of if, it's just a question of when. You know, this is a really breakthrough, revolutionary technology. The FDA, you know, is very eager to get this thing classified, and we're working very diligently with them to get this through the approval process, and we're very confident it should happen relatively soon.
Okay, Imaging 3 Incorporated, stock symbol IMGG. As always, Dean, thanks for the update.
Thanks again, Don.